The Jacobi Medallion signifies a career dedicated to true excellence. It is the highest honor of the Mount Sinai Alumni Association, awarded each year to Mount Sinai alumni and faculty members for distinguished achievement in medicine or for extraordinary service to the Mount Sinai Health System or the Alumni Association. Jacobi Medallion honorees embody the aspiration of Mount Sinai to advance science and medicine in the name of better and more effective care for every patient. Jacobi recipients are exceptional physicians, visionary researchers, great educators, and talented administrators. They have expanded our understanding of biomedicine and have ensured that young physicians know how to apply that knowledge to heal their patients. They are, very simply, the pride of Mount Sinai. Congratulations to the Jacobi Medallion winners of 2022.
For us, the questions in education relate to what our learners learn, how they learn it, what's missing from their education, what are the structural barriers that limit our students and trainees from reaching their full potential. The questions are countless in health professions education. We have challenging and complex questions, and we need to solve those puzzles. And here at Mount Sinai, we've taken that head on.
Rina Karani focuses on innovative approaches to faculty professional development and mentorship, and has mentored hundreds of trainees and faculty who are now themselves renowned medical education scholars and change leaders around the country.
Education is the bedrock of this institution, and Rina has really transformed the curriculum. She has worked tirelessly for decades to make education great at this institution and combat racism and bias in all its forms.
This is us trying to explore and understand more, and what happens when we think of interpersonal and internalized belief systems and bias. In health professions education, we are at the time of a revolution, not just in terms of content, but in terms of approach. We've spent a significant amount of time thinking about our faculty and ensuring that we can support, promote, and coach our faculty to represent the communities that we serve.
She has taught me how to speak for justice, how to speak up for people who don't have a voice at the table.
We have integrated into our curriculum core skills related to community-based health, global health, physician advocacy, human rights. These are key competencies that we believe our physicians of the future need, and it is our obligation to ensure they are prepared for that future.
By honoring Dr. Rina Karani, we're honoring a woman who is an extraordinary educator, leader, physician, and person whose work creates a better future for all of us.
When I got the call about receiving the Jacobi Medallion, I was completely floored. In fact, I asked if they had made a mistake or an error.
We are honoring a woman who has devoted herself to embedding important values and core principles in the work that we do so that we can train generations of future physicians.
A teacher has the role in changing the lives of so many through this process. I knew that I wanted to be impactful in terms of really helping the next generation think about how the lasting legacy they have is in teaching and learning.
I was in the first full class at Mount Sinai, so that was the class of 1968. Everybody sat in awe of the clinical opportunities that were available, and what I would say was the most impactful was the mentorship of a selected group of individuals that were the giants in their fields, encouraging me to essentially follow my heart. They encouraged us, taught us, trained us, made sure that we recognized that knowledge is critical, but clinical care and empathy is as important as making the appropriate diagnosis. And that has stayed with me literally for my whole career.
Naomi Lubin is a pioneer investigating transfusion safety both in the lab and in the clinic, looking at complications such as graft versus host disease from a molecular and genetic perspective. This work has markedly enhanced therapies for these very serious conditions.
Hi! It's so good to see you. I am sometimes known as the mother, some would say the grandmother, of pediatric transfusion medicine. My research as a pediatric hematologist has been focused specifically on a broad variety of vulnerable populations and transfusion risk.
She has done so much to advance that field with respect to quality and safety, bringing this life-saving service to children locally, regionally, nationally, and in fact around the world. She has defined best practice in that field.
One of the things she pointed out is the fact that premature babies in the neonatal ICU are hooked up to a lot of tubes and plasticware, and what toxicities might result from the plasticizers that are in the plastics that are connected to them and the transfused blood products.
Her impact on Children's National Hospital has simply been transformative.
By honoring Dr. Naomi Lubin, we're really honoring a woman who's changed the field of pediatric transfusion medicine.
It's very, very meaningful to me to be able to receive this award. Why are we here? Why do we do what we do? We do it to improve the health and well-being of a child and their family. Every single day, if I'm doing something either in the clinical lab, in the research lab, or mentoring a junior faculty person, I'm always thinking about the premature infant that is way born too soon. The child who's undergoing cardiovascular surgery and I know is going to have a large number of blood donor exposures. The hemophiliac boy who is going to need to go on chronic transfusion. I see those faces of those kids that I've treated over the years every time I'm doing something.
You have to remember who you are as a person and as an institution because it matters. And it's important that institutions have archives because people have their memory, but institutions can lose their memory. People come and people go. So I think that having an archives helps an institution remember who it was. Mount Sinai has been along a path, and each step followed along behind it.
Barbara Niss has done more than anyone else to collect and preserve the history of Mount Sinai and all of its many entities. Thanks to Barbara's leadership and tireless work, Mount Sinai administration, faculty, and students can access more than 200 years of material on our rich tradition of providing patient care and advancing medicine through education, research, and outreach.
Not everybody grows up thinking, geez, I want to be an archivist, because most people have never heard of an archives. I started here at Mount Sinai in 1986. I started with an office filled with metal filing cabinets, as well as boxes of material just stored on the floor.
What Barbara has given Mount Sinai during her 35 years as institution archivist is truly a monumental achievement.
What was appealing about it to me was that it was about history. It was about taking things that were maybe a mess and putting them in order, and then using that knowledge to help people answer questions that they had.
The role of an archivist in an institution is incredible. It has the ability to connect history, it has the ability to connect people, and it also has the ability to tell a story and remind people about our amazing history. And I think Barbara's done that in just such an exceptional way.
You have to find history interesting. You have to be willing to see connections and think critically about it. The more you know about a place, the more interesting it becomes to you, and the more multi-layered it is, and you discover new things. Why do you open a hospital? The 9 men that got together to open the Jews Hospital in the city of New York in 1852, I mean, why would you do that? Because helping other people is the right thing to do. The founding of the school kind of shows just the constant striving that Mount Sinai has always done towards creating new knowledge, creating excellence.
It's a humanized history that emphasizes the role of men and women. Here we invariably find wisdom, energy, commitment, extraordinary and sustained generosity, and a relentless determination to achieve success.
When I found out when they called to say that I was getting the Jacobi Award, I was literally speechless. It's always been my belief that the more you know about a place, the more interesting it is to you, the more tied you feel to it. When you find out that we're just not good in the past 20 years, it's been the past 160 years, there's real feelings there that can get attached and help people understand Mount Sinai and the place they work, but also feel proud of it themselves.
I fell in love with maternal fetal medicine from day one of my residency. The wonderful thing about maternal fetal medicine is that it truly is a mission. It's a calling to bring the healthy baby into the hands of a woman that is at high risk. So to be able to be part of her journey, her pregnancy journey, and have an extraordinarily great outcome is one of the most rewarding moments that you can have in your life. I feel like at Mount Sinai I've had the opportunity to take that moment and move forward.
Joanne Stone is a world-renowned physician scientist with special expertise in women's health and fetal imaging. Joanne has recently been appointed as the Health System Chair of Obstetrics, Gynecology, and Reproductive Science.
Anybody who's had a baby here in the last 30 years can thank her, because she set the bar very high, and we've had and continue to have one of the safest, best departments in the country.
I can't even count the number of lives that she's impacted because of her involvement in shepherding women through high-risk pregnancies.
She has been successful because she is creative, she is thoughtful, she is innovative, and she conceived ways to answer questions that couldn't be answered beforehand.
Always, on a daily basis, we're confronted with new situations that don't necessarily have answers. So part of our mission is to try to find those answers. So for example, with ultrasound, we are looking at ways of diagnosing fetal abnormalities earlier.
Ultrasound was a window into the closed space that the fetus lives in prior to being delivered. She recognized that if she could use ultrasound to help guide the movements of a needle placed into the amniotic sac, it would be possible to do minimally invasive things with the fetus.
If you have a patient who has an infection that led to fetal anemia, we can actually transfuse blood into the fetus and cure the fetal anemia. I mean, that's amazing to be able to do something like that. Or other fetal interventions where we can solve the condition in utero, leading to a healthier outcome.
I think her lasting impact in the field of all of OBGYN is she's become an incredible role model for women.
I would absolutely consider Dr. Stone one of my mentors, and in many regards, she has really informed my career. She also has an uncanny knack to really be laser focused on a vision that she sees not only for herself, but for you as a mentee.
I am so honored to receive this Jacobi Award. Women are the entryway into healthcare for their families. I feel like we provide the most amazing care for women in the entire New York area. Being the recipient of this Jacobi Award, it really highlights all the work that's done by so many members of the department.
She will certainly take this department to be among the top in the nation.
You have to think big and you have to dream big. You have to seize every day. You have to capture every moment and make it work for you and keep striving to be better and better.
How do I see myself in the journey of discovery in environmental health? I think what I uniquely brought to the field was this laser focus to design studies that ask not only how do I measure chemical environmental factors, but how do I also measure social environmental factors, and how does that play out in the context of disease that we're looking at. It was my dream to go to medical school and be a physician, and I never would have imagined that this is how I would be having an impact.
Rosalind Wright is internationally recognized for her work in the breakthrough field of exposomics. Roz has broad expertise in environmental exposure assessment, as well as genetics, epigenetics, and psychosocial stress measurement applied to environmental health studies. This research promises to change the course of human diseases through identifying the role of the environment on human health.
Roz has had a major impact on the landscape of research here at Mount Sinai, and in particular, her impact on child health research has really been felt.
Exposomics matters to health because it has been the missing piece to the puzzle of what has been driving the increase in chronic disease burden in this country. Why do we see diabetes occurring earlier in children where we had never seen that before? We have to think on the full scale of the environment, not just chemical, physical environmental factors like air pollutants and metals and other toxins, but also the social environmental factors and social determinants like living in a safe community rather than having high crime and violence exposure.
I think throughout her career, Roz has really had this perspective of whole life events. And she realized that it really began in childhood and even in utero that could potentially affect the long-term outcome of these patients. And I think that's been one of her strengths in her research.
What moms are experiencing and exposed to gets to the fetus already. We start to examine air pollution exposure in women living in urban metropolitan New York area and incidence of asthma in their kids, and we've linked that together. We measure the social factors that might be driving that, and women were experiencing high levels of stress at the same time. That translated to increased risk of asthma.
I think when we look back on Roz's time here at Mount Sinai, she will be recognized for the tremendous contribution she has made to research in the area of health disparities and the effects of environment on people.
When I got the phone call that said, hey, congratulations, you're going to be awarded the Jacobi medallion, I was just astounded. What we've been able to do in 10 years is just, to me, remarkable. It reflects what we saw in Mount Sinai when we were coming here, of giving people freedom to do high-risk, high-reward team science and really ask and answer the questions that we knew had to be done to address these 21st century health problems.